So that's the nice thing about an X-ray, it's black and white. And you can see here, this is the white thing is a filling. This is the nerve. And this is the picture of a child which is getting new teeth. These are the permanent teeth, and this is the temporary teeth that last for 8-9 years. Or sometimes they change earlier. The front teeth change when you're 5 or 6 years old. And these are the back teeth. And then when I zoom in on this one, you see here a little dark hole and a bigger dark hole. This is where the mineral goes out. The normal gray zone is with enough minerals. The darker zone is with less minerals, because the X-ray go through the teeth, and wherever they find resistance, there's no X-ray on the plate. So the filling holds all the X-rays. Here, this black hole is because there's nothing, there's space. But here, you see the loss of minerals. Here's a little bit loss of minerals, here it's longer. In this stage, you can remineralize the teeth. Then this system will work. And what I discovered, there was maybe 3 to 4 years working with the patients to find out what exactly is the right mineral. And I discovered that it's calcium, magnesium, but then what's very important is that these minerals are really from nature. Because the body resonates with nature, not with things that are made in a factory or produced chemically. It's how nature works. We are part of nature, and so I tried very different kind of supplements, and then eventually I found one with the magnesium gluconate and the calcium gluconate and the magnesium carbonate, and then in a ratio 2 to 1. And then it still did not work. We found the good products, but it didn't work. Then was another research, and then I discovered that you have to combine this calcium gluconate and magnesium carbonate with apple cider vinegar. When you combine these, you get an immediate action of the vinegar with the calcium minerals and the magnesium minerals. And then that combination can go through the stomach, in the small intestines, and it will be absorbed. But then there was another problem, or things I had to find out, and then I went back to this book, to the vitamin K2. So what is vitamin K2 doing? And then another vitamin is vitamin D3. What is vitamin D3 doing? And then vitamin D3 makes it possible that the calcium and magnesium are absorbed in the body. But then the vitamin K2, which is vital, makes sure it comes on the right place. So people with a lot of tartar don't have enough K2 because they drop the minerals behind the teeth. People with blood vessel problems, where there are remains of minerals, they have a lack of K2. People with joint problems, they have too much bone in the joints, a lack of K2. And it's also interesting because K2 was everywhere earlier days, because all the grass-fed products, milk, cheese, even other vegetables contain K2, but less and less. So if you don't have K2, you have not a problem with the absorption, but the distribution. It gets nowhere. And it's funny that Weston Price found it out, and that the scientists discovered vitamin K2 only in 2007, 70 years later. And then you come back to this, and that's why I call it remineralization package. We have to take care of the mitochondria. They need the minerals with a good frequency. And these minerals is not only calcium and magnesium. It's also with iodine, copper, potassium, and zinc. They have to be in balance to work well. But in order to remove the oxidants or the garbage, they use vitamin C. And vitamin C is also another story, because we know vitamin C as ascorbic acid, but nothing is further from the truth. Vitamin C contains 5 elements. I come back to that later. And another factor which removes the garbage are 3 oils. It's krill oil, it's ubiquinol, and vitamin E. And interesting enough is that vitamin E and vitamin C help make collagen. And collagen is maybe a difficult word, but are all the fibers in your body, of the skin, of the tendons of the muscles, but also of the vessels of the blood, and also with the protection of the muscles and the fibers in the muscles. And some people eat collagen in the hope that they have more collagen. But when you eat collagen, you break it down to reusable parts, and then it has to be put together. And it's done under the influence of vitamin C and the 3 oils, especially vitamin E. So now you know why people with high blood pressure, old skin, bad growing nails or hairs have a problem with that, because they have a lack of vitamin E and vitamin C. But also regarding these two, regarding the removing of the garbage, these are called antioxidants. The garbage are the oxidants, and these products are the antioxidants. So in order for the mitochondria to work well, you need the minerals and you need the antioxidants. But in the same time, they help building the collagen. They help revitalize and keep the tooth strong.